Hey guys, it's Jeremy, the coach. Gonna start going a slightly different direction. I have noticed there have been some positive responses to the videos on nutrients. While there are not infinite nutrients, so I can't do infinite videos, I'm gonna go with that direction. Today I'm gonna talk about vitamin B1. If you look at a nutrition label, it could be called Thiamin. It also could be shown as B1. It's the same thing. It's an essential nutrient that all tissues of the body need to function properly. To say essential, the word vitamin. I don't remember what language. Maybe it's Greek, maybe it's Latin. Comes from two words: vital and amino. Ami, meaning containing nitrogen. So vital means necessary for life. Now, since the the combining of those root words, there have been other vitamins found that don't necessarily contain nitrogen, but it's still the same idea. Um, B1, thiamine, it's an essential nutrient. It's needed by every single cell of the body. It helps the cells change carbs into usable energy. Has a role in muscle contraction, which is huge for the heart because your heart's a muscle. Conduction of nerve signals, also good for the heart. That's what your natural pacemaker is. And strengthening the immune system, therefore having a function in boosting immunity. Um, it is also used as a preventive treatment for those at risk for cataracts. I am going to go into vitamin A in a few sessions from now. As far as immunity is concerned, B1 is taken over the counter. You can get it anywhere. But it can also be prescribed to AIDS, HIV patients to partially make up for the loss of immunity that these viruses cause. Studies have also shown that B1 promotes healthy kidney function, slows the onset of and development of kidney disease in diabetes patients. It's a water-soluble vitamin, meaning it needs to be taken with water and also gets flushed out with water. That means it's not stored in the body. Taking too much, for the most part, generally is not damaging. But this is where one of those cases where I say 100% RDA, recommended daily allowance, is the minimum. 100% will keep you where you're at. Chances are, this includes myself, chances are your body is missing something, needs something that needs to be repaired. So beyond 100% is suggestible. If you have any disease that B1 is effective for, it is very important to take these supplements to make sure you have extra in your diet. Without these conditions, vitamin B1 can take it through the diet without much need for supplementation. For the most part, again, you'd have to see your doctor. It's found in pork, beef, poultry, legumes, whole grain products, which have lots of B vitamins, nuts, soybeans, and peas. You can get B vitamins through refined grain products, but natural 100% whole wheat is the way to go. Basically, what happens is when you're getting a refined grain, you're getting white bread, you're getting pasta, it gets stripped of certain nutrients. So it's a money thing. They want to make that pasta last as long as possible, so they get as much out of it as they can, more portions out of the same thing to make more money. That's what refined grains are. The companies do stuff to it to line their own pockets. You can get it through refined grain products, but 100% is the way to go. Something I learned in school is general rule: if man made it, you can't eat it. So whole grain's the way to go. It's so much better for you. Some symptoms of B1 deficiency include headache, weakness, irritability, depression, abdominal discomfort, reduced mental alertness. Very important for people with any kind of mental illness to take B1 supplements. Again, body's not perfect. The mental illness is coming from It could be depression, schizophrenia. You could have Alzheimer's. Um, it's something going on in the brain. So definitely required to take extra B1. B1 deficiency is often found in people who drink excessively, as alcohol. It's actually important if you drink a lot of caffeine too. But alcohol and coffee leach B vitamins from the body. Extreme deficiency can also lead to heart failure. So it's also important, like I said, for mental illness, for kidney diseases. And if you're a heart patient, you have to take B1. Stated earlier, B1 is a water-soluble vitamin, as it has to be taken with water, and also gets flushed out with water. So it can pass through the body. If you're taking a pill that has 200%, but your body only needs 25%, your body's getting rid of 175%. Doesn't use what it doesn't need. So, but throughout the day, if you exercise, you smoke, things like that, the body changes throughout the day. The metabolism changes throughout the day. So it is suggested, and I do this myself, I take 2 specialized vitamins and 2 multivitamins spread out throughout the day. It is suggested to take 2 to 4 per day, whether in a multi or as a standalone supplement. You can get it at your local Walgreens, CVS, whatever pharmacy, your vitamin shop. It is sold as a standalone at these places or in a multi. That's hence how I get it. Or you can get it in a supplement. You'll find a supplement at certain stores. It's either called Super B or Super B Plus C. Generally, they're the same thing. It's only a labeling issue, not a product issue. Super B has all the B vitamins, and a lot of times there is loads of vitamin C in it. So Super B Plus C, depending on where you get it. Super B, I will do in another video, as it has all the B vitamins. Usually I would say see a doctor. But in this case, especially if you have mental illness or a kidney problem or AIDS, like one of those things I mentioned. But generally, I would strongly suggest supplementing your diet with B1 or in that Super B. It is a necessary product for life. So with this video, I'm hoping you learned something, trying to help and educate on what's missing in diets. There's a lot of things. Well, I'm not claiming any cure. There's a lot of things that will go away based on your diet. Not everything. But it's vital. Like I said, vitamin, it's a necessary mineral for life. So, go take your vitamins. Have a good day.